In this lecture, I'm going to share with you some information in the area of medical sociology that's not covered in the textbook. I'll talk about why sociologists are interested in health, one of the major theoretical models sociologists use to explain the relationship between social factors and health, and introduce the SF-12, which you'll be taking as part of this module and using for one of the discussion questions. There are many reasons that sociologists are interested in health. The most compelling reason, I think, is because there's lots of evidence that health outcomes and access depend on your position in the social structure. In other words, your health is related to things like your race, your gender, and your class standing. As an example, as your class standing improves, so does your health. This relationship has been consistently documented for over 100 years. We also know that no matter how you measure class or how you measure health, as socioeconomic status increases, so does good health. This relationship is known as the SES Health Gradient. Research also shows that even in areas where there's little inequality, those who are a little better educated or have a little more money have better health. Even your perception of your class position in comparison to those around you has an effect on your health. This is something called relative deprivation. If you think that you're worse off compared to your neighbors, your health will be worse. This is what the SES Health Gradient looks like. The slide shows the percentage of people who say their health is fair or poor, graphed against household income. People who earn less than $15,000 per year are much more likely to say their health is fair or poor compared to people who earn $50,000 or more per year. This is another example from a study done in 2002. The study focused on teenagers. The slide shows the percentage of teenagers who said their health was fair or poor and the percentage who said their activity was limited due to their health. Teens in the lowest family income category are more than twice as likely to report their activity as limited compared to teens in the highest family income category. So, we know that class standing is related to health. We also know that race and gender have an effect on health outcomes. The textbook does a good job of reviewing some of this research. But why are race, class, and gender related to health? Well, sociologists use the stress process model to explain these relationships. This model suggests that your access to resources and your exposure to stress are influenced by your race, your gender, and how much money or education you have. Stressors are events that cause you stress. Stressors can be short-term, like going through a divorce, or long-term, like experiencing financial strain because you only make minimum wage. Stressors can also be major, like getting laid off, or minor, like the hassle of commuting to work every day. Resources are things that help you deal with stress. Resources can be material, like owning your own car or having a savings account, but resources can also be people in your life who can help you, family or friends. Sociologists call people resources social support. Another type of resource is referred to as psychosocial. Examples of psychosocial resources include high self-esteem and something called mastery. Mastery is your sense of how much control you have over your own destiny. According to the stress process model, a poor person has worse health compared to a middle-class person because they encounter more stressors, maybe in the form of financial strain, and have fewer resources to manage those stressors. So how can these ideas be applied to your own life? This is the subject of one of our discussion questions this week. The SF-12 is a very short questionnaire which assesses your physical and mental health. It should take you less than 5 minutes to complete. Your results page will look like the one on this slide. As you can see, there are two scores, a PCS score, which is your physical health, and an MCS score, which is your mental health. Write down these scores. Both scores have a range of 0 to 100, with higher scores equaling better health. The mean is 50, and there is a standard deviation of 10. This means that if you scored between 40 and 60, you are like most people who have taken it. In other words, your health is average. If you are below 40, your health is poor. If you are above 60, congratulations, your health is pretty good. For the discussion question, use the stress process model to explain your level of physical and mental health. I'll be sharing my results too. See you online.